Part of our Metrocentre Way is performing an open-ended vasectomy. But with the knowledge that I have with microsurgery, understanding the vas deferens, we don't just have an open-ended vasectomy, but we have a reconstructed procedure not to compromise any of the tissue. So the testicle would be a surprise to most people that it produces 10 to 15 million sperm a day, and this continues on after a vasectomy. If you suddenly close the end attached to the testicle, the microtubules that store that sperm can get swollen, and if that pressure goes up suddenly, some patients can get a cascade of inflammation. So the way to actually avoid that is not to suddenly close the end off attached to the testicle. It's to do a reconstruction, to leave that end open in the process. There will be a pressure valve release that will release sperm. That sperm gets released under the skin, but eventually it'll slowly close over, but it's not a sudden event. And after looking at scrotums of vasectomized males, and I've looked at almost 4,000 sides of men that have had vasectomies using the ultrasound, I notice a difference between those who have had sudden closure and those that have had an open-ended approach, and those of my predecessors who have done thousands and thousands of vasectomies who've come to see me for reversals. Those tubules look very, very healthy. So the recovery after a vasectomy is actually very good. We tell patients who have sedentary jobs they can go back to work the next day. Those who have particularly physical jobs are advised to take it easy, recover over the weekend. They can usually go back to work with modified activities, not to strain too much. Certainly from an exercise point of view, we advise patients not to get straight back into the saddle. Cycling very quickly. Cyclists are usually very hardcore, as are most people that go to the gym. Tell them to be sensible. The first day, the day of the procedure, we really do recommend they just go home and relax and watch DVDs, take it easy to minimise the chance of any hemorrhage. To date, I've never had a hemorrhage, and our patients have scrotums that look quite normal with little, if any, bruising. So we want to keep that good track record. So the advice is, take it easy.